I, I have the honor of introducing our next guest. Dr. Georges Benjamin is the Executive Director of the American Public Health Association and has been providing leadership to the organization since 2002. In this role, Dr. Benjamin has been leading the organization's push to make America the healthiest nation. The APHA, an advocate for violence prevention policies, endorses a comprehensive public health approach to address the growing crisis of gun violence. As a Maryland native, we're really fortunate to have Dr. Benjamin here with us to present this evening's keynote address on the importance of a public health approach to addressing gun violence. Dr. Benjamin.
Well, thank you very, very much for allowing me to spend some time with you. Let me see if I can share my screen real quick here. Let's do that again. Can you see my screen?
We can see it.
Okay. And hopefully they'll advance. So let me just talk a bit about, obviously, we fear firearms. We kind of normalize them through our entertainment. They're certainly a big part of our culture, and we believe they can protect us. But as you heard earlier, far too often people kill themselves with suicide or tragically homicides. The tragedy of mass shootings, which of course is even impacting our own kids, and the tragedy of when one person accidentally shoots another, and far too often this happens with our young people as well. We're continuing to see this issue around mass shootings. All I can say is that historically, every time we have one of these, we do the look back and we find something that we missed. It has an enormous societal toll. Every day 100 Americans are killed with guns on average, and that's over 300,000 people annually. You've already heard that predominantly suicide is the most common reason people die from firearms. Homicides are about a third. We also kill our intimate partners. On average, each month, about 57 women are shot to death by their intimate partners in our country. Again, a growing problem with kids. But it's even dwarfed by the number of people who are, of course, injured by firearms. More than 200 non-fatal firearm injuries daily. At enormous cost to our society, almost 230 billion, almost 12 million bucks, $0.8 million a day. I can tell you what I would want to do if I had that kind of money. And you notice not all medical treatment, legal fees, long-term care, mental health, emergency services. And for those of you who are involved in government, understanding that government pays a lot of these costs, either directly through our services that we provide to our citizens, through the Medicaid program, through our component of a range of services that we provide people in the mental health system. This is a very, very costly problem for our nation. I want to acknowledge the Second Amendment. We certainly have a Second Amendment right, but even when Heller was decided, it was decided the fact that there are limits. I say that because we now know that people often use the protective argument of firearms. And of course, every time something bad happens, as we've had during COVID, as we've had every disaster in our country, people run to the store and they buy more firearms. And yet, like many things in our homes, having a firearm in your home puts you at more risk of being either injured or killed with that firearm. Now, I'm sure there are people out there that say, oh, no, that's a real problem for us. And but I just argue that, I've been an emergency physician, and I know that there are lots of things in our homes that put us at risk, but we don't treat them the same way as we do guns. We lock up the poisons when our kids are around. We put childproof locks on things to keep our kids out of that. We even put little sockets in the outlets so the kids won't stick things in the outlets. We don't seem to have the same due diligence with our firearms. So public health tries to look at things by defining the problem, identifying risk and protective factors, developing and testing those protective factors, and then trying to figure out widespread adoption. So many, many years ago, we had real problems with particularly teens and automobile crashes. We worked very hard to make those automobiles safer. We made people safer in their cars, and we made the environment safer for cars and people. We used a multidisciplinary and multi-sectorial approach to do that. And you can see that we basically brought the number of deaths down. At the same time, we're seeing the number of firearm deaths going up. So public health interventions do work when you focus on the problem, identify those problems. And by the way, we did not outlaw cars. So I would argue that we ought to figure out how to make firearms safer, make people safer with their guns, and make people safer in an environment with guns in it. And as an example, many of the things we can do, we know there's a lot of technologies that have been developed over the years to kind of make sure that the firearms themselves are safer. You know, right now, no one else can use your cell phone unless they know your code. Yeah, I'm sure there are certainly people that can hack them. But there is smart gun technology. We just not really advanced it enough as much as we ought to. Just putting integrated trigger locks on the guns. You know, far too many people have died or been seriously injured because they picked up a firearm very carefully, but they didn't realize the firearm was still loaded. And so load indicators would make a big difference. Finding ways to reduce the lethality of guns. I would argue military style assault weapons are a real problem. And one of the problems is because of the ammunition clip size that we allow them to use. You know, making people safer with their firearms. You heard a very important part of that earlier, but licensing, just simply licensing people. We license people to drive an automobile. Why not license folks to have a firearm? Increasing access to mental health services, certainly for people we know at risk. Remind you that people who are mentally ill are much more likely to be the victims of violence than they are to be the perpetrators of violence. Teaching people nonviolent confrontation. Doing more requiring in ways, firearm safety classes, just like, again, automobiles. Doing broader education. Physicians, particularly pediatricians, counseling their families around safe storage of firearms. And of course, doing that safe storage at home. And then of course, a safer environment with firearms. You know, the whole idea of getting universal background checks is very important. We really need to do that, close the gun show loophole, make sure that we put in place rules around people having these checks, and making sure that the background check system has enough time to make sure that someone can get the check done, and not just make it automatic that if the results don't come back in a short period of time, that the firearm is already authorized. You know, many years ago, we stopped the Consumer Product Safety Commission from actually looking at firearm safety. We do that for teddy bears. We do that for bicycles. We do that for any other consumer product. We need to do that for firearms. Creating a whole range of programs that are violence intervention programs that we know work. And of course, as an ER doc, I'm very supportive of a robust trauma system around our country. And then finally, the issue around data and research. You know, several years ago, the system, members of Congress stopped our federal government from doing the kinds of research that we thought needed to be done to get the answers to many of these questions. They stopped the funding. They've now rewritten history and pretend like that was not the case, but they did stop research. But now that's been reversed. And so there is going to be funding for firearm research that's beginning to come out the door at the federal level. But I think more importantly, we need to begin getting the data and looking at the data we already have. We've got a lot of barriers to having researchers get access to what is normally public data around firearm related shootings. Engaging more effectively with our criminal justice system and our law enforcement officers to try to put in place systems. You can do this with data without taking away anyone's individual right to have a firearm. But we just haven't done it in our nation as well as we need to. And I want to give a shout out to the National Violent Death Reporting System, because that is a system that we've all been supporting that will help us. But now we need to make sure all the data gets in the system to help make this this research tool very effective for us. With that, I'll stop. And if there are any questions, I guess I'll be happy to take them with the other speakers. Thank you.